I'm Ginny Rentko. I'm a veterinary internist. I've been a veterinarian for over 30 years. Like many of my classmates, I've always wanted to be a veterinarian since I was 5 years old. I was the daughter who brought home every stray animal that there was to be found. And then once I started to learn the science, I was a biology major, undergraduate, really dialed into the science and the investigative properties of veterinary medicine. Being a veterinary internist is solving problems, trying to figure out the puzzles of what's wrong with the dog. I have a background in both pharmaceutical drug development as well as academic practice at Tufts University. I'm the former medical director of the academic teaching hospitals at Tufts, and I've spent the past 4 years working with animal bioscience, getting leap years off the ground, doing the necessary studies and investigating the science in dogs to get leap years where we want to bring it to market. As you know, the human-animal bond runs deep. The older a dog gets, the deeper that bond we feel. We feel the need to take care of them and see that they are as healthy as they can be and enjoy their life as long as they can. And so with leap years, not only are we doing well for our dogs, but we're actually doing well for us too, because we know what we get from that bond. It just feels good for both dog and pet parent. The concept of cellular health is new. It's only in the recent maybe 2 decades or so that scientists have really been investigating the science of aging, really getting to understand the genetics of it. And so cellular health is really at the basis of every chronic disease that we get. Aging is the risk factor, the biggest risk factor for any chronic disease, both in humans and in veterinary medicine for animals. So getting at the cellular health level is really fundamental to all of the disease processes that could happen in an aging animal. And so the way that leap years works is at the cellular level. It has 2 functions. One is it boosts NAD, which is a really important cofactor for mitochondrial function. Now, mitochondria is the powerhouse of the cell. It works in ways to create all the metabolism of the cell to keep the cell healthy. And if you have a healthy cell, then you have a healthy organ, then you're not getting a chronic disease. The other piece of it is when we age, our cells get old. And sometimes these senescent cells, as they're called, they don't die, they don't divide, but they secrete these inflammatory properties, these cytokines that affect other cells. And then they make those cells senescent. So the way that leap years works is on a monthly regimen. The first 2 days of the week, the dog takes a combination chew, a senolytic and the NAD booster. We lyse all those senescent cells over the 2-day period. And then each day after that, for the full month, they take an NAD booster. So all the healthy cells now have a higher level of NAD that they can work with to remain healthy. When I talk to a pet parent about whether they should try leap years for their aging dog, the question is really about what are their goals for their pet? Do you want them to be able to get back up on the couch with you if they haven't been? Do you want them to be able to go on that hike that they really have been resistant to do because of whatever chronic illness they have? And then once we establish what the goals are, then we say, well, let's work toward them. Let's talk about what we can do to get them to a better quality of life. The joy I think that pet parents see is in dogs that have cognitive dysfunction. You know, dogs, the incidence of cognitive dysfunction is quite high in aging dogs, but it's not very obvious to a pet parent because they see it gradually happening and they think, oh, my dog is getting old. Well, does your dog have to age in that way? And that's where leap years comes in. We have seen the most dramatic effects on cognition in the older patients. Well, maybe that's because they've had the most cognitive decline. So the way I talk to pet parents about whether you should give leap years a try is to think about what the goals are and if we can positively impact it.